Documentation is the bane of every recreation therapy student's existence. It can be incredibly confusing, and if you're not thinking about it in the right way, can really make your job hard. I'm here to help you make it a little easier with Newman's Helpful Tips, the RCPT 401-400 Guide to Documentation. Progress notes. Okay, this should be starting to make sense now. For this course, each progress note is going to be written in a SOAP format. Now, depending on where you wind up interning or working, different progress note formats will be used. But for our purposes, SOAP is a good basic way for us to begin to document progress. SOAP stands for subjective, objective, assessment, and plan. Subjective data is that which you observe or that the client states, and the main characteristic of it is that it's open to interpretation. Things like feelings, emotions, beliefs, things of that nature. When you include things like the client was happy, you have to explain what leads you to say that in the note. You have to provide evidence. So if you're saying the client was happy today, you have to also follow that up by saying this was evidenced by the client was smiling, laughing, interacting with the other participants, and really engaged in the activities. Objective data, on the other hand, is essentially data that you can count, such as a number of smiles, a number of negative outbursts, time spent on task. All these things are measurable, and that's the important distinction between subjective and objective. It's very hard to measure an emotion. However, we can measure how many times a person smiles. And it all depends on the goals that we have set, kind of what data goes in each section. Moving on, the assessment part of SOAP is your assessment of the subjective and objective data and what that means for the client's progress. So if our goal is to elevate a person's mood, the subjective data might say the client reported feeling sad today, or the client was sad today as evidenced by not talking to others, they were frowning, they did not engage in the activities, those type of things. The objective data for that might be that the client cried 5 times during the 1-hour session. The objective data might be that the client did not attend. The objective data might be that the client only spent 30 seconds attending to the task. So what does that mean when we look at those things all together for their progress towards elevating their mood? It doesn't look very promising because they're just not into what's happening. There could be a number of different reasons for that. They may just be having an off day. They could have had something that happened to them right before they came in. Maybe their lunch was late. Maybe they had a negative interaction with another client. We don't really know. But in our assessment, we have to kind of try to figure those things out. And so it may be that if they're not engaged in the activity, maybe it's not the right activity. Maybe we need to try something else, which brings us to plan. Every time we're assessing a client in a progress note, It's with the idea that we would want to make the treatment as effective as it can possibly be. So in the plan part, we might want to talk about if the client was not engaged in our activity, maybe we want to try a different kind of activity in the next session. So your plan is the adjustments and recommendations that you think need to be in place for the next session to make it more effective. Continuing on with progress notes. So when you are completing the note in each area of SOAP, you need to talk about the data in terms of each goal. It might be nice to talk about the weather. It might be nice to talk about the mood of the group, or any number of other things. However, if those things are not related to the goal and the client's response to treatment, they really don't have a place in the progress note. So to help us stay on track with that, in the A part of assessment, restate each goal. It specifically talk about the data, what the data says about the client's progress towards the goal. If things are going well and no changes need to be made, it's okay for the plan section to say, continue with the treatment plan as it's written. But I will caution you, don't let this be your go-to. It's our responsibility as professionals to make sure that we are providing the best services that we can. If your clinical judgment says you think something should be different or something might be more effective, say so in your note. It's really, really important. Once you get to the end of the treatment period, you'll be looking back at these notes to prepare the discharge plan. So make sure that you're helping yourself by giving yourself good information to work with. You've heard the old saying, garbage in, garbage out, and it's really applicable in this situation. The more effort you put into your progress notes, the easier your discharge plan is going to be, because you have good data to help you make decisions. The discharge plan. We're almost to the finish line, or maybe not. It depends on our client and our efforts in the treatment planning and facilitation of the interventions. Regardless, our goal here in the discharge plan is to summarize the progress, or lack thereof, towards goals during the course of treatment. In the quizzes that are provided for you to do this documentation, there are 3 discharge plan recommendation boxes. In the first discharge recommendation, you need to restate the long-term goals stated in your treatment plan. What progress was made over the course of treatment towards each of those goals? Now, be very specific for each goal. In the second discharge recommendation, we want to talk about how the client responded to the treatment. Did it seem to be working with that client? How was it working for the client? If there were problems, what were they? Be really specific here. Not just did they like it or not, it's more about what was effective for the individual. And sometimes it's just as important to talk about what was not effective for the individual, because not only does it help future therapists avoid the same mistakes, it also helps us to help other clients that we might be working with in the future to provide better services for them as well. Everything we do adds into our pool of clinical experience. The more we can document it, the more it is able to help us in the future. Lastly, in the third discharge recommendation, talk about what you would recommend the client do next. Should they continue in the same treatment program? Should that treatment program be adjusted? Should it include different activities? Should they try something completely new? Or should they seek future resources in the outside community? It all depends on where they are in their health journey. What your responsibility as a therapist is to provide your client with concrete and realistic recommendations that will maximize their positive momentum and keep them moving in a positive direction in their health journey. In conclusion, by following these guidelines, your documentation should be consistent, it should be relevant, and it should be actionable, resulting in good service for your client. And importantly to you, the best representation of your skill and professionalism. Now, I'll leave you with this thought. Remember always, always to use good clinical language and appropriate clinical symbols and abbreviations. This is because your documentation must be understandable by practitioners in other professions. Working in healthcare, we use a different, it's almost like a different language from the general population. Words have specific meanings in healthcare communication. Make sure that you understand what you're saying. And I mean really understand what you're saying. If you don't know what a word means, look it up. Don't guess. With the technology that's available at our fingertips in this day and age, there's no reason to misuse words, especially in clinical documentation. I hope that you found these tips helpful. Make sure when you're going through and completing the quizzes for this class that you look at the hints provided at the bottom of many of the sections in the documentation. Those hints will tell you exactly what I'm looking for in those areas. So between the hints and this presentation, you should be in pretty good shape. As always, if you need additional help, just get in touch with me and I will sit down and go over this with you individually if you need be. Our goal is that you are successful and the best future professional that you can be. Now go and get it done.